Welcome, everybody, to Revive Health's Daily Briefing Live for Tuesday, April 14th. This is our 30-minute review of the latest, most important news, resources, and advice for health system marketers and communicators who are dealing with the COVID-19 crisis. I'm Chris Bevelo, Health Systems Practice Lead at Revive Health, and your host for this show. I'm joined by Chase Kleckner, who is Senior Marketing Manager at Revive Health, and our show's producer. Hello, Chase.
Hey, Chris. Glad to be here.
Glad to see you again, sir. And we're also joined today by Stephanie Weirwell, who is Vice President of Content here at Revive Health. Stephanie leads our content marketing practice, working with hospitals and health systems across the nation to determine what stories to tell and where to tell them across all channels, from social and digital to traditional. Stephanie, hello.
Hello. Thanks for having me.
Yeah, thanks for joining. Looking forward to diving in here in a little bit with you. As with each show, we plan on covering the latest news on COVID-19, how it relates to what you do in marketing communications at hospitals and health systems, and share what we're seeing and hearing from Marcom professionals across the industry. We want to make this an open forum as much as possible. So if you have questions for Stephanie or I, or Chase, any of us, just throw those in the question queue in Zoom there at the bottom of your window at any time during the podcast, and we'll get to as many as we can at the end of the show. You can also use the chat function in Zoom to talk to other attendees. And Chase will be using that chat function to post URLs for stuff we cover, so you can access those immediately. But if you do want us to answer a question, make sure it ends up in the Q&A queue. Remember that you can subscribe to this podcast on iTunes. So search for Revive Health Daily Briefing Live. We also post a video recording of every episode that afternoon, and you can find that on our website at thinkrevivehealth.com. If you want to go to our communications hub for COVID-19, that's thinkrevivehealth.com/COVID-19. We have recordings of the podcast, other content. So definitely give that a look. A couple of other important notes. One, for those who have listened to the podcast on a regular basis, I've had this lingering cough that comes from the flu, not COVID, in February, if you can believe that. It's particularly bad today, because I worked out this morning and I pushed myself harder than normal, and apparently my lungs didn't like that. So I will try to keep the coughing to a minimum, but just for folks who haven't joined, so you don't worry about COVID. You can't get COVID through Zoom anyway, so you'd be fine even if it was that. But we are not experts on COVID-19, obviously, as you can tell from that comment. So not a place to come for medical or scientific advice. We do have perspectives on marketing communications, and how you all could be managing the COVID-19 crisis. Just keep in mind that everybody's situation is different, your organization, your community. So keep all of that context in mind as you hear what we have to say. So let's start with the news. And as we do every day, we start with a review of the latest case count and death count for COVID. We do that just to try to keep an overarching perspective on the things we're talking about. Obviously, we're still seeing an upswing, though hopefully talking about plateauing here in the back half of April, and in certain markets, that seems to be happening. So as we think about that, using case count as our guide, that kind of colors everything we think about. And then once we come down onto the back end of this mountain, that will also change how we think about things. So we use the Johns Hopkins University tool. And when I refreshed at the start of the show, we are at 1,945,055 cases globally, and up to 121,897 deaths globally. The United States, of course, is still out there in front. Not sure if the difference between us and the folks behind us continues to grow. It sure seems like it, but it's not growing as quickly as it was before. So that's a good sign. That's a sign I think we're slowing. At least the pace is slowing. The acceleration is slowing, not the velocity, I guess, is going back to my physics. Oh, is that physics, Chase? I'm not sure.
Yep.
Thank you. So in the United States, we have 584,073 cases, and 23,709 deaths. So those deaths are really climbing high. The projections have been anywhere from 40,000 to 240,000 We still have a ways to go, unfortunately, because we haven't reached peak in this country, though we're hearing out of New York, probably the biggest hotspot in the country, that they really think things are plateauing there. But plateauing can take a while, and then you have to come back down the other side. Plus, we have other hotspots like Detroit, Chicago, and other metropolitan areas in particular across the country. Obviously, this is affecting everybody, not just in big cities, but it's those metro areas where if we're still anticipating a peak yet to come, that death count is going to continue to rise to levels that nobody likes. So we will keep an eye on that. The other thing we wanted to point out was there was a news story. This actually came late last week. We didn't talk about it, but it's probably worth mentioning. And it's, most of you probably know this. If you don't, you should definitely dig into it. But there was an announcement that maybe it was an announcement, but I think it was already part of the stimulus package from the White House that said hospitals taking money will have to pledge to agree not to send surprise medical bills to patients treated for COVID-19. The story from AP says that hospitals that accept the grants will have to certify they won't try to collect more money from the patient than would have otherwise been owed if the medical attention had been provided in network. Which is interesting. That really kind of oversimplifies what the problem is. In the story, it says a spokeswoman for the organization, which organization I do not have cited, some organization, said it's their understanding that the ban on surprise billing will apply to doctors as well as hospitals. So that's a really important point because surprise billing is a complex issue that certainly is not the sole onus of hospitals. As you know, typically what happens is hospitals contract, where surprise billing happens most of all is hospitals contract with independent physician groups to manage and operate in their EDs. And so when you go in there, you may think that the hospital you're going to is in your network, but you may be seen by a doctor who's not in network. It's not always ED physicians, but that seems to be the main focus of surprise billing. And so, yes, you may not be in network for that hospital, but that also goes to the relationship between the physician group and the hospitals themselves. Physician groups often refuse to take on the same level of coverage that the hospitals that they're operating in or that they're working in have. Also, their payers are part of this as well, not willing to kind of bridge the gap. So it's a complex issue. So understanding that would apply to those emergency room physicians would make a big difference. The other thing that the article doesn't talk about is how this would align with the White House statement from a week or so ago that the federal government will cover the cost of COVID-19 treatments for those who are uninsured or underinsured. Obviously, that kind of fits in there because underinsured could apply to being out of network, depending on your definition of that, or even uninsured. So I'm not sure how that is reconciled. It would be great to hear from someone in the health system who has figured this out or who has dug deeper. If you've got feedback on that, please let us know. You can post it in the chat. You can email me at cab@revivehealth.com. We're looking into it ourselves, but obviously the folks out there who are dealing with these kind of situations on a regular basis, particularly with COVID-19, where with the vast majority of people coming in through those EDs, you guys were probably ahead of the game on it. So please let us know and we can report that back out. Last thing I'll mention before we get into the conversation with Stephanie is remember to visit that communications hub I mentioned before, thinkrevivehealth.com/COVID-19. We have recordings of these shows, as I mentioned, the video recordings. We have the content from our bi-weekly e-newsletter that goes out where there's more intel on how to manage COVID-19. And then we also have our latest report on the consumer survey we ran now just about 2 weeks ago. It's the second version of the survey, so you can kind of see the change that we had from the first one we ran, which is now maybe going on a month ago. I probably got those days off a little bit. But we've done a subsequent survey, and I think we have plans to do another one. And the key with continuing to do these surveys is to see the changes as this progresses across the country. So it's a great resource to see how consumers are thinking about COVID-19, but more importantly, how they're thinking about you at hospitals and health systems, what they expect from you in terms of information, the frequency of that information, that type of thing. Which is a fantastic segue to talking to Stephanie, who's here to talk to us about how we should leverage content. So I would like to think, Stephanie, that we had planned for that segue, but I don't think we did. Is that fair?
Yeah, that's perfect. Yeah, so, one of the biggest discussions that we've really been having with hospitals and health systems this week specifically is how to keep patients engaged during COVID-19 through content marketing. And it's, of course, been talked a lot on this podcast by Chris and others already about how with elective surgeries on pause and with hospital volume being shifted to COVID-19, that it's really critical to continue to stay in touch with patients and not lose that brand preference that's already been generated in the market during this time. And, that's sort of always been the job of content marketing really in a normal time, is to feed the top of the funnel and build relationships. But I think right now it's especially critical. And so as always, we start, with audience behavior and really saying, what does consumption look like? And we're seeing some interesting trends, I think, during the pandemic. And the data has sort of showed us what we all feel is true, which is nice sometimes to have that corroborated. And it shows us that time spent online has really increased. And according to a recent study by Global Web Index, 2/3 of Americans are searching online for COVID-19 updates. And so on one hand, that might not be unsurprising, or it might be expected, but I think it's just interesting to pause on that for a second, because it's a pretty significant cultural shift. We've talked just in marketing, for the last 3 to 5 years about how media has been incredibly fractured. It's hard to reach the masses. People are doing all kinds of different things on different channels at different times, and no one's really been tuned into one thing. And now all of a sudden you have 2/3 of Americans doing the same online behavior for weeks at a time and really focus on the same thing. So I think that's just an interesting shift. But, with that said, we're also seeing the data show that 87% have increased their consumption of indoor media. Again, not surprising, broadcast TV, online videos, streaming TV. But where I think it gets really interesting is that Facebook is the go-to platform, according to the same study, with 46% of U.S. consumers citing Facebook as that #1 source. So for better or for worse, that is kind of where people are spending their time. And I think it's important for health system marketers to be thinking about that in terms of a critical way to reach people.
Yeah, that's really good. Chase, I can't tell. It looks like Stephanie's frozen on mine. We can still hear you, Stephanie, so we're good. One of the things I want to ask you about is, based on that research, one of the things I've heard from a number of people anecdotally, so I'm curious as to whether this is, what's behind this, is the idea that folks are trying to they're trying to minimize or reduce their presence on social media. And the reason given is almost universally, it's just too much. There's just too much cacophony. There's negativity. There's always a political angle to a lot of social media, even though a lot of folks create their bubbles on Facebook and Twitter. I just wonder, to what degree is that really happening? It sounds like it's not, at least at a significant level. But I wonder if that's something we could dig into to try to learn more about, to what degree are people reducing, because it's overwhelming.
Yeah, I think that's been an ongoing discussion as people have seen that social media has some negative influences on mental health and anxiety, but platforms like Facebook and Instagram and others have done such a great job of keeping us addicted. And there's a lot of psychology into the addiction of those news feeds and how they do keep you coming back. So, we always hear just anecdotally people saying they're quitting social media, but the data hasn't really shown that. And I think it's partially due to the fact that it's hard to get away from it. And especially in a time like this, we're seeing, live gatherings or live virtual gatherings really increase, in the sense that Instagram Live and Facebook Live have had trouble breaking through with their live video platforms until recently. And now all of a sudden those tools have really blown up. So I think right now people are hanging to those social tools as a way to stay connected with people.
Yeah, that's all fair. And I think, it's really in the data to see what the impact is. I've mentioned on the show a couple of times, I quit Facebook, I think it's going on 3 years ago, mainly because I wasn't happy with the privacy of the data, how it was handled. Quit Twitter 2 years ago because it was just too much antagonism and conflict and If you're going to be on there, you have to be okay with that. And I wasn't. And then maybe 6 months ago, Stephanie, what my go-to is a bunch of media sources. Just, I've got links all collected on my homepage of my iPhone that I would just go to repeatedly. And I think really when the political season started getting heated, that became overwhelming. And so my simple step was to take that collection of links on my home screen of my phone and move it all the way back to to screen 6. So now if I need to get to it, I have to scroll through all of my, homepage screens, which it actually did limit. And now in COVID, I probably check that thing once in the morning and once at night, and that's it. So I think we should dig a little deeper. Let's move on. One of the things you want to talk about was Facebook in terms of advertising.
Yeah, so, what's interesting and it's kind of ironic is as usage has seemingly increased over the last couple of weeks and months, the cost for advertisers has decreased. And so I think that presents a really interesting opportunity for hospitals and health systems specifically who need to get their message out. And what that means in terms of the cost of decrease is that news just came out a couple of days ago in a Wall Street Journal article that CPMs on Facebook, the cost per 1,000, the cost to reach 1,000, are lower than ever, and it's dropped 15 to 20% from February, likely because retailers and other large brands are not advertising there at the moment because many don't have a brick and mortar store to drive people to, or they just need to not advertise at the moment. So a lot of large brands have kind of slowed on their advertising, and so CPMs have dropped. So I think as health systems think about how to get their message out and often have small budgets, that's a really interesting opportunity to jump in on.
Yeah, and what's interesting about it is normally you would want to leverage that for if you're using paid social to drive folks into service line opportunities. A lot of those are offline now, right? So do you use that money to drive people into COVID information? Maybe, though, should you spend money on that? Folks may find it anyway. That's kind of your call and depends on how far you want to go. But an opportunity that I think you're going to dive into in a second is continuing to sustain your brand around being seen as a resource for health, which obviously takes a different spin during the COVID-19 crisis.
Yeah, absolutely. And I know you all had shared the ReviveHealth consumer survey findings a few days ago or a week ago or so. And one of the findings there was, of course, people want to hear from their hospitals and health systems, but they also want wellness information from them. And, I just think about how back 2 months ago when things were normal, it was challenging for hospitals who maybe had a message about, let's say, chronic back pain or something along those lines, and that message is right up against a beautiful beach photo from a travel, company, or right up against, a restaurant trying to serve up incredible food or whatever it was, right? And so now all of a sudden everyone's focus had shifted towards health and wellness, and perhaps some of those messages might even break through the clutter even more. So I think it's a really interesting thing to think about. What does wellness look like at this time, and what does it look like to have those top of the funnel health messages? And when we say wellness, I just want to be clear, there are hospitals that are promoting blog posts that say 5 ways to increase your immunity. And I think, there's a time and a place for that, but we're going to show in a second here kind of our definition of what that means in terms of wellness content. And I think it's just thinking beyond the average message, thinking beyond, how to stay healthy during COVID, and also thinking beyond the format in terms of really leveraging the trends that we're seeing, like live video and just video content in general, people are spending more time with, or even influencers as a means of a method to share those messages, or even including physicians. So we'll dive in a second on those kinds of things, but I do think there's a significant opportunity now that many hospitals have already shared the facts about COVID, and they've shared, kind of what they're doing in terms of the front line. Now the next step is let's keep people happy and healthy as they're on lockdown and at home in really interesting ways.
Yeah. And I think, all of that, as we said at the start of the show, you got to keep this advice in relevant or relative to the situation you're in, right? So should New York Presbyterian be doing this? Probably not. They probably don't have the resources. They don't have the focus. Obviously, if you're in a community where COVID hasn't hit to that degree, this opportunity makes sense. But even if you're a health system in a community that has had impact, maybe other than New York, let's say, or even New Orleans, you remember that there are a lot of people, the majority of people are not personally impacted by COVID-19, even in those communities. So while they may have wanted to understand, like, what's my risk and what are the symptoms, they've got that down. So they still would like to hear from you, even if you're in a hot spot. And again, you have to be careful about your resources and your priorities, but there's a lot of people, most people, who still would benefit from health, even with COVID sitting out there as the main threat.
Yeah, yeah, absolutely. And we've been seeing that, as we've worked with health systems in various markets. Of course, each market is impacted in different ways, so you certainly have to take that into consideration. But I think to that point, as we start to think about how do we keep people engaged, because we know that we'll need patient volume down the road, it's important to think about those who are not affected, because to your point, that is the bulk of them, and that is the bulk of those who maybe they're sitting at home with, with back pain, or maybe they were about to have a bariatric procedure, or perhaps they have cancer, or whatever it is. And so I think being really empathetic to everyone's situation and sort of even segmenting the audience in the sense of what are people going through. Some have anxiety, some do have conditions that they're managing, some are just bored at home, some are worried about the economy. Like, I think all of those things are really important to consider in terms of content creation, is thinking what are our content streams for these different situations that people are going through.
Yeah, so let's go ahead and share the example. I'm going to set it up just real quick, Stephanie. I think we've talked about the Health Esteem campaign on this podcast, or at least referenced it before. This was developed a couple of years ago for Franciscan Missionary of Our Lady's health system down in Baton Rouge. And we really hold this brand effort up in many ways, because it is a leading example of a number of things, of a health-oriented brand, of what we call a post-health system brand. So a brand that's focused on what your audience desires and their needs and their motivators, not on promoting yourself. There's just all kinds of great ways that this brand stands out. But what you're going to share is kind of how they've taken that and applied it during the COVID-19 crisis.
Yeah, that's exactly right. So we've had this Health Esteem platform going on for a while in partnership with the Louisiana Health System, and really saw this need to shift it towards COVID-19. And I know you all have spoken a lot on the podcast about shifting brand campaigns. So this is just a kind of an example specifically around wellness. So there is a social platform, specifically Instagram and Facebook and others, but these are just some examples of the content that's been shared recently. And this first one is a video where they actually pulled in one of their health educators, Adrian, and I'll keep the sound off here, but he's doing these really short kind of 1-minute fit breaks and fun ways to stay healthy. So something that he just shot on his own, and he's not someone on the front lines. And I think it's interesting to think about, are there nutritionists or physical therapists, or even others who maybe are not on the front lines, who can be sharing some fun little pieces. And this kind of plays into the fact that you see, just from a consumer standpoint, like yoga studios doing live sessions right now, or other gyms doing live sessions. And so I think it's interesting for health systems to do that as well. A couple more examples here are, we've included influencers in the program, and often it's easy to think about the hospital as like the main storyteller, but we've seen influencers are really craving partnerships at the moment, because they're shifting their content towards COVID-19, right? Like, they're talking to their audiences about how to stay at home and what to do. And so we partnered with 8 or more influencers just in those local markets in Louisiana, and they're sharing their own personal stories of here's how they're staying healthy during the lockdown, and here's what they're doing. And that's been a really big driver of success, because of course they have audiences that are tuned into them, who then are saying, okay, now I know a little bit more about what this hospital is doing. We've also shared these sort of just fun videos about things you can do indoors, some fun little ideas. And then, they are a mission-based organization. So certainly tying in faith and tying in mental health. And then last, just some other examples of videos of, we saw screen time is a meme that everyone's kind of sharing around of like, man, my screen time is higher than ever. So obviously that has health impacts. And so we kind of jumped on that and shared these little tips. So these are just sort of the beginning and some ways to think about it. But I think just a couple quick high-level takeaways are, health systems can really think about going beyond public health and medical facts and kind of empathizing with what people are going through, and maybe even leveraging some of those folks that are not on the front lines, whether it's physicians or physical therapists or others. I think involving influencers is really important. We heard even the Surgeon General a couple of weeks ago had a call to action to influencers to say, join this movement and help people stay home. And then last is just incorporating maybe even service line messaging, right? Like helping people manage pain, and then promoting all of that with paid media, because we know that if CPMs are down and there's less clutter, then it's a really great time to be sharing that kind of messaging.
Yeah, that's great. And a great place to end. I think, just to wrap that up, you hit this a couple times, Stephanie, but there are still opportunities to engage your communities with your brand during the COVID crisis that aren't about COVID. They have to be related, they have to be reflective of it, but health is a great place. And that's so important now, so that you can stay in front of your audiences, and really important for the rapid recovery phase, so that you've engaged people, and those who need care are going to be coming back to you when you're able to deliver it. So it's just such a great way to kind of prepare for that. So Stephanie, thank you so much for joining us.
Yeah, thank you all. This has been fun.
Yes. And Chase, as always, sir.
Absolutely.
Thank you. If you'd like us to cover something that we haven't hit on, float that in the chat channel right now. You can email me at cab@thinkrevivehealth.com. Don't forget to check out our communications hub at thinkrevivehealth.com. You can go to the banner of our homepage, that'll take you to it, or thinkrevivehealth.com/COVID-19. Tomorrow, we're joined by Jack O'Brien, who is the finance editor at Health Leaders Media. He focuses his coverage on high-level financial strategy. So maybe we can get some clarity on the news story I talked about earlier. He authors the weekly Health Leaders Finance e-newsletter and the monthly Health Leaders Finance podcast. So another podcaster. So definitely join in for that. And don't forget to subscribe on iTunes. And as we sign off every time, when we sign off on the show, keep up the good work. Hang in there, everybody. The work you're doing as marketers and communicators it's so critical to the health, financial health of your organization, to the physical and clinical health of the people you serve. And all of us in this country need accurate, transparent communications to get through this pandemic. And we're relying on the folks at the hospitals and health systems for doing that. So hang in there. We're here with you. We are here every day as long as this crisis is with us. So thank you for joining, and we will see you tomorrow.